I get it. You've been playing pickleball a few nights a week, you feel the twinge in your elbow after a long rally, and you're staring at a shelf of gadgets that promise clinical strength healing. The last thing you want is to drop cash on something that sounds fancy but ends up gathering dust. You're looking for proof that this thing actually helps you stay on the court, not just a glossy brochure. Link is in the description if you want to check the product details on Amazon. When I started digging into red light therapy for sports injuries, I found a surprisingly mixed landscape. There are cheap LED panels that barely reach therapeutic wavelengths, and then there are clinic-grade units that require a dedicated room and a power draw that would make a small fridge jealous. The PicklePulse clinical strength red light therapy device lands somewhere in the middle. It's marketed specifically for pickleball players, it's a whole body unit, and it uses pulsed, multi-frequency light that's supposed to penetrate deeper than a steady beam. The big question is whether those claims translate into real, everyday relief for someone who's just trying to get back to a weekly game. First off, setup is pretty straightforward. The unit comes in a single, relatively compact box that you can set up on a floor mat or a sturdy table in your garage or living room. You plug it in, turn a dial to select the pulsed mode, and step inside the rectangular frame. The whole process takes under 2 minutes, which is a relief compared to the clunky rigs that need assembly and calibration. I tested the timing on a typical post-game routine. After a match, I'd hop in, set the timer for the recommended 1015 minutes, and let it run while I stretched. There's no need to attach any sensors or wear any straps, which is a plus for people who just want to walk in, light up, walk out. Now, the real test is how it feels when you actually need it. I have a mild tennis elbow from a recent series of aggressive backhand drives, and after a session on the PicklePulse, I noticed a subtle warmth that seemed to seep into the muscle. It wasn't a burning sensation, more like a gentle heat that you get from a warm compress. Over 3 days of regular use twice a day, morning and evening, I found that the soreness dulled a bit quicker than it normally does. It's not a miracle cure, you still need to rest, ice, and stretch, but the light therapy felt like an extra tool that nudged recovery along. Who should consider buying this? If you're a regular pickleball player, say, 35 times a week, who deals with typical overuse complaints like sore shoulders, wrist fatigue, or lower back stiffness, this could be a worthwhile addition. The device is built for whole body exposure, so you can treat multiple problem areas in one session. It also works for non-pickleball folks who enjoy other racket sports, yoga, or even office-related neck tension. Basically, anyone who wants a low-maintenance, at-home recovery aid that doesn't require a prescription or a visit to a therapist could benefit. On the flip side, if you only play casually once a month, or if your injuries are acute and require professional medical attention, you might be better off allocating that budget toward a good pair of supportive shoes or a few sessions with a physical therapist. The PicklePulse isn't designed to replace professional care, it's an adjunct. Also, if you're cramped on space, say, you live in a studio apartment, the unit's footprint, while not massive, still needs a dedicated spot where you can step in and out without knocking over furniture. Looking at the strengths, the first thing that stands out is the clinical strength label, which isn't just marketing fluff. The device uses a higher power output than many consumer-grade LEDs, meaning the light can reach deeper tissues. Users who have tried lower-powered lights often report needing longer sessions for any noticeable effect. With PicklePulse, the recommended 10-minute window seems sufficient for a perceptible change. Another practical advantage is the pulsed, multi-frequency setting. Some studies suggest that varying the pulse can stimulate different cellular responses, and while I'm not a researcher, the fact that the unit lets you toggle between a few preset patterns gives a bit more flexibility than a single-tone device. The weaknesses are equally important to flag. First, the price point is higher than a basic LED panel, which could be a deterrent for budget-conscious buyers. The device also draws a noticeable amount of electricity, so if you're watching the utility bill, you'll see a modest increase. It's not a silent operation either. There's a low hum from the cooling fans that some users might find mildly annoying during a quiet meditation session. Finally, the lack of a built-in timer means you have to manually watch the clock, which is easy to forget when you're relaxed and might lead to slightly longer exposures than recommended. Another practical consideration is the whole body claim. In reality, the light covers a rectangular zone roughly the size of a yoga mat. That means you have to position yourself strategically if you're